Well, just passing by, it was in my neighborhood, so I thought I'd try it. They accepted many different insurances, so also I wasn't feeling well, so I needed to get some professional help from the doctor, and I also get physical therapy here once or twice a week, and it's very good. It's been very helpful. I feel better, and taking medication that's helping me. My body feels healthier, and I'm very satisfied right now. And I will continue to visit here and follow through with the chiropractor and physical therapy and the doctor.
Dr. Chakote, do you have other doctors here at the Empire Medical Service?
Yes, we do. As I said earlier, we have cardiologists on the staff, neurologists, pain management, rehab doctors, and family practice doctors, and we have quite a few other internists also.
Okay. What kind of health insurances do you accept?
We accept most of major medical insurances like GHI, Blue Cross Blue Shield, Aetna, AmeriChoice, Atlantis Health, Medicare, Medicaid, and WellCare, and we do accept no fault and workman compensation patients too.
Okay. Now, why do you feel people should come to the Empire Medical Services as opposed to another center?
As I said earlier, our office is like a one-stop shopping center, meaning the patient come, they get all the, if a patient need to see different specialties, they can see in one center, number one. Number two, we have all diagnostics procedures in our office like x-rays, sonograms, echocardiograms, bone densitometer, laboratory tests, and if you want to do any blood test, we do everything at our office.
And,
You
and
don't
you,
have to leave our office.
and you get the results quickly.
Right, like for example, if you want to do the x-rays, we get the x-ray right then and there, and we read then and there, we get the results within 2 minutes. As compared to the hospital, I was talking to one of my staff member yesterday, they take like 3 to 4 days in the hospital, where we're doing 3 to 4 minutes at our center.
My name is Asiya Bobby, and today was my first day coming to Dr. Chakote's office, and it's really clean and nice, and they helped me a lot.
Yes, Dr. Chakote, as we both know, there are many problems in this country concerning the uninsured as far as health insurance is concerned. If somebody's out there, they're not feeling well, what do you advise patients who may not have insurance? Can they call this agency?
Sure, I encourage them to call our office. As you said, we have 4 locations, and we charge a very minimum amount of fee to take care of those patients.
So you work something out, payment
Yes,
arrangement?
yes,
with
we
them?
do.
Okay. Now, as you know, a lot of people in this nation, in this city, there seems to be more overweight people. But overall, what kinds of health problems do you see on the rise in your view, in the practice that you have in New York City area?
That's a good question. You told like there are a lot of patients with obesity, high blood pressure, diabetes, and asthmas, which are not breathing disorders. We see a lot of those cases.
Okay. So those are the ones you're seeing more and more of, correct?
Right.
Okay. Now, name once again some of the treatments that people can receive here for cardiology, for example.
As I said earlier, also the patients who have chest pain, we have echoes, stress echoes, electrocardiograms, and we have heart doctors on the staff.
Now, what do you mean by chest pains? Every once in a while, somebody may get a pain in the chest. Is that correct?
That's right, because when we get a chest pain, we most of the time we relate the chest pain could be several conditions. Could be from the heart, could be from the lungs, could be the chest wall itself. And most of the time when we refer the chest pain, it refers to the heart. That's what we are worried about. That's the reason we suggest the patient to come, encourage them to come and visit us and take care of themselves.
So, at what point a chest pain should be a concern? If somebody has a pain for what? How much time? How many days? How many whatever, weeks or whatever, what would you say?
Well, I would suggest like people who are male and who have high cholesterol, hypertension, and who are smokers, who are diabetics. If they have a chest pain, they should be concerned. They should go to the doctors and check.
Okay,
Checked out.
okay. All right, so it's something that's been going on for a little bit of
Right,
time,
right. Whoever this called risk factors.
Okay, all right.
Yes, he's very good. He's very thorough, and he's a very nice man, good man, and he helped me a lot. He's very understanding. I would highly recommend this office. It's in nearby Flushing and easy to reach on Northern Boulevard by bus, and it's a great area and great people, and they will have patience with you and help you.
Yes, Dr. Chakote, tell me, what can a patient expect when they first walk into the Empire Medical Services office? Right now we're in the Flushing office, so generally speaking, what can they expect walking into any of your offices?
We have a nice, clean offices, warm, friendly office staff. Office manager greets the patient. We take very good care of the patients.
Okay. Now, we know we live in a multicultural city, and I see that you have 4 offices, two in Queens and one in Brooklyn and Manhattan. So you must encounter a lot of different types of patients in terms of linguistic backgrounds. Does your staff speak other languages besides English?
Yes, we do. Our staff speaks Spanish, Hindi, Urdu, Persian. People from Afghanistan and Iranian countries, they can almost welcome here.
And how about, do they speak Korean?
Yes,
there's-
we do have a staff who speak Korean and Chinese languages.
Oh, so you pretty much have a good representation of languages here, just in case any kind of patient comes in, right?
Yes, we do.
Very good, very good. Now, we're right now in the Flushing office, and follow-up episodes, we're going to be visiting other of your offices. Can you describe some of the rooms in this Flushing office?
Yeah, sure, I will. In the first room we have is electrocardiogram machines, which we take EKGs for patients with palpitation, irregular heart, chest pains, and we have a spirometry. What does it does is it's called pulmonary function test. People with short of breath and so forth. We have another machine called autonomic nervous system test machine. Patients with the diabetes, hypertension. Diabetes and hypertension is controlled by autonomic nervous system, meaning parasympathetic and sympathetic nervous system. We have that machine which detects which system is working than the other ones. So we can block that particular system and we can control the diabetes and hypertension and asthma very well. The next room we have the exercise stress machine, and patients, again as I said, we provide cardiology services. Patients with chest pain, they can do the stress test and so forth. And we have a echo sono machine. Again, we check the patient with abdominal pain. We have the technician standby who does the ultrasound of the abdomen, pelvis, and echocardiogram to check the irregular heart, again valve diseases. And next we have a X-ray machine. Again we have a technician standby, patients with neck pain, back pain, pneumonias. We do the X-rays then and there.
Right.
And subsequently we have the chiropractor on the staff who takes care of the back pain. And the next room we have is pain management doctor. As I said, he takes care of the pain and rehabilitation. And subsequently we have a physical therapy room, and we can see there are treadmills and bicycles and electrical stimulation and ultrasound machines.
You know, briefly, I would like for you to look at the camera, and you have an 800 number?
Yes, we do. The number is 800-310-4660.
Okay, so if people want to contact the Empire Medical Services, they can use that number.
Yes, sure.
Could you repeat that again?
It's 1-800-310-4660.